During my first clinical rotation as a medical student in pediatrics, I had a traumatic experience that put a fear of pediatrics in me. We had a 1-year-old child who was quite sick. She was brought in very sick by the parent. It took frantic efforts from all the doctors on call to be able to stabilize that child. I was one of 2 medical students on call that evening, but that experience is one I will never forget. Hello guys, and welcome to my YouTube channel. My name is Dr. Peter. Some of my friends call me Dr. Kiro. On this channel, I do a little bit of medical lifestyle and a little bit of academics. If you're a medical student or a young professional who want to have a smooth medical school experience and smooth transition into clinical practice, then like and subscribe to this channel. You'll find a lot of helpful videos here. So back to my story. The effort it took all those doctors, including me and my colleague, the medical students of call that evening, to stabilize that 1-year-old, put in quite a scare in me about pediatrics. And this fear is something a lot of young doctors face. So after your training as a student and then you become a doctor, there's that gnawing feeling in your chest, knowing that whoever walks through that door, if you are working in a hospital, you owe that person a duty of care. True, we know, deep down you know in your heart that at every point you can actually refer the patient if the situation is beyond the care you can provide to that patient in your immediate facility. You should refer the patient. But you also know deep down in your heart that there's a lot of things you should know, and you might feel inadequate if you are not able to do this. There's a truckload of knowledge that you have learned in medical school, but I assure you there's still more to learn, especially when it comes to clinical practice. So now, back to my experience. 6 doctors, 2 medical students, a lot of attempts to get in an intravenous line into the child who was hypovolemic, dehydrated and all that. My fear was, so what if this child was to meet me practicing in one community? What would I do at that particular point? What if the nearest facility is 2 hours away? What am I going to be able to do at that particular point? This feeling is something a lot of young professionals face. But before we go into how you're going to deal with it, I'd like to remind you of something Michelangelo said. Now, Michelangelo is that famous, medieval painter who painted the ceiling of the Sistine Chapel. At 90 years after practicing sculpturing for 65 years and more, he said, "I always learn." And the great Socrates, in all his wisdom, he had a maxim that says, "Your greatest knowledge is knowing that you know nothing." There is always going to be a lot to learn in medicine. There's still going to be one syndrome you've never heard of. There's still going to be one diagnosis that is recently updated in the New England Journal of Medicine. There's always going to be new information that you have to know. So how do you reconcile that with having enough confidence to be able to dispense your duties as a doctor in the community in which you practice? 2 things come in handy here. And the first thing I want to talk about is the Pareto Principle. Now, the Pareto Principle is where one of the maxims most clinicians say come from. You will always hear elder clinicians saying things like, "Common things occur commonly." As a young medical student back then, it was confusing. What do you mean by common things occur commonly? What if something happens? What is the random chance of things happening? But as I begin to practice, I'm beginning to see every day that you are going to see 700 patients with normal shaped kidneys before you see one patient with a horseshoe shaped kidney. You're going to see a lot of children with diarrhea disease before you see that one child with Cushing's syndrome. So there's always going to be common cases in the community in which you practice, and that is where this maxim comes in handy. The Pareto Principle is also known as the 80-20 rule. Now, you know that 80% of the world's wealth is owned by 20% of the world's population. We know that 80% of people live in 20% of cities. We know that 80% of the world's body water is in 20% of the world's ocean. So there is always that imbalance. So if you can make a list of all the disease pathologies that can affect an individual, as a doctor, you are likely going to spend most of your time managing just 20% of these illnesses. Now, the goal of this principle is not to make you a Pareto doctor, but it therefore follows that you have to spend a lot of your time learning how to manage the most common condition which the people in the vicinity where you practice suffer from. This is going to lead me to the next point I'm going to talk about, which is your value as a doctor. Your value as a doctor comes in twofold to your patient. The first, which is the most dramatic, is the interventional care you're going to be giving to your patient. So you have a patient who slumped, who is unconscious and was rushed to the emergency room, and you have to do something as a doctor to that particular patient. And that is one phase of your care. The second phase of your care is the security you provide with the mere knowledge that you exist and you work at a social facility. This reminds me of one quote by an old-time physician, Henry Longfellow. Henry Longfellow said, "It is the smartest of physicians that cure diseases, the wisest of them prevents it." So there's this joke I always tell my friends, that if I ever get into orthopedic practice or neurosurgery practice, I'm going to spend a considerable amount of time and energy convincing the road safety agencies and the transport security companies to pay a lot of strict attention to users of the road, because the less traffic accidents happen on the road, the less my duties as a neurosurgeon. And that is where that security you provide to the health of people comes. As dramatic as the interventional role you play as a physician is to the patient, you have to also realize that your job is done when you have no job to do as a physician. Knowing that you are not Gregory House and knowing that you do not know everything creates some level of humility in you as a doctor. And this humility is good because it makes you double check your decisions, it makes you scrutinize every step you make. But this humility should never deteriorate to incapacitate your duties, especially to the duties you know and you have the ability to perform. Yes, it is very important to find a source of continuous learning, somewhere where you can get nuggets, reminders, fact checks as a doctor, and the internet is going to help you a long way, as well as all the reference books you can also have. Also, never forget that you always practice with the first principles. So at all points, you practice with your ethics, autonomy, confidentiality, justice, maleficence. You also always practice with the basic principles. First, you save the life, then you save the limb, and then you can let the patient save the looks. It's always important to practice with the first principles. Secure the airway, secure breathing, make sure circulation is ongoing, and you continue with your ABC, and you continue with ABC in the principles of your management. It remains that at all times, if you follow the principles, you are almost always going to be right. I'll leave you with this quote by Hutchinson to remind us of who exactly we are as doctors. From inability to let well alone, from too much zeal for what is new and contempt for what is old, from putting knowledge before wisdom, science before art, and cleverness before common, from treating patients as cases, and from making the cure of the disease more grievous than the endurance of the sin. Good Lord, deliver us. Thank you guys for watching. See you in the next video.